Okay, good afternoon, everyone. Today is December 10th. The time is 2:01, and the meeting of the Greater Boroughs Advisory Board is now called to order. My name is Isabella Crusoe, and I'm the chair of the Greater Boroughs Advisory Commission or Board. This open meeting of the Northborough or the Greater Boroughs Advisory Board is being conducted remotely, consistent with Chapter 2 of the Acts of 2025 relative to extending certain COVID-19 measures adopted during the state of emergency. All members are allowed and encouraged to participate either in person all remotely. This act allows us to, the public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream or the recording of this meeting may do so at Northborough Media Connection on the YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. And members, when I call your name, please respond in the affirmative. Taylor?
Here.
Anne-Marie?
Here.
And Isabella from Northborough here. And then staff, we have Michaela Petty, who is our regional epidemiologist and shared service coordinator, and we have Vinnie Gu, our new regional health agent. So with that, we will start the meeting.
Did you want me to go?
Sure.
Okay, so we have a pretty short agenda, but we'll start off with having Vinny introduce himself. He's our new health agent, and I think Taylor, I think you've met him already. Isabel, no? Okay, that's Friday. But I will pass it to Vinny and let him introduce himself.
Hi, good afternoon, everybody. Can you hear me okay? All right, excellent. Yeah, so my name is Vincent Gu. I'm excited to be a part of the team. I spent the last 3 years as a career firefighter out of Natick, Massachusetts. Prior to that, I was a regional health agent, primarily based out of Tingsboro, Tewksbury. So I'm excited to be here and thank you for having me today.
We are very excited to have you. So over the next couple weeks, Vinny will be shadowing different inspectors in the region, as well as meeting with health departments, boards of health, really whatever your town is looking for. So Vinny introduced himself to the Northborough Board of Health last night. And I know he has a meeting with the Southborough Health Department on Friday. So Anne-Marie, whenever you're available, I think you have a Board of Health meeting upcoming, so you can coordinate with Michaela and Vinny. He will be shadowing Chris Craig, who is an agent in Northborough and Southborough, as well as Ray in Westborough. So the trainings have been going great, and Vinny and I will kind of coordinate when he's ready to start inspections on his own. Any questions?
So is he going to be only doing one specific area, or will it be like housing, food?
Yeah, so the primary focus will be food and then any ad hoc inspections that a town may need. So if Boylston, needs additional help with housing, we can support that.
Okay.
And then it's also, if you would like Vinny at the health department in Boylston, 1 day a week, every week, that is also an option. We'll just need to coordinate that through Michaela. But that's an option.
Okay. All right. Well, if it's okay with him, unfortunately, our Board of Health meetings are on Monday evenings, usually the last Monday of the month. But due to the holiday, or excuse me, the fourth Monday of the month, this month it falls on the 22nd. So I don't know if that's something that he could do at 6 p.m. But anyway, we'll decide that after, I guess.
Okay.
That's fine.
Is that only in person?
Yes.
Okay. All right. We can figure something out.
I mean, they do call-ins. I don't know, but I think because he's brand new, I think they'd want us to at least meet him in person, shake his hand and things like that. So.
All right. Any other questions, Taylor? All right. Perfect. Back to you, Michaela.
Awesome. Yeah, thank you. Happy to have Vinny on board and can't wait to start all the introductions and getting training. Vinny, you're welcome to stay on if you want. But you're also welcome to hop off. We're going to talk about our scope of services for our strategic plan that we're looking at requesting quotes for. So I have it pulled up, but if people just want to pull it up and talk through it, I'm also happy to share my screen if that's easier for people. But just want to talk through kind of the specifics of objectives and activities.
If you could share your screen, that'd be great.
I can do that.
Yeah, that would be fabulous. Please.
Yeah. Okay, can everyone see that?
Uh-huh.
Okay. And if you have trouble reading the text, I can also make it bigger. Does anybody need it bigger? Can everyone read that? Okay. So last time we looked at this, we did talk about increasing the budget to 30,000. And then kind of the specific piece of feedback was adding a little bit more about looking at sustainability over the next 5 years. So added this objective. And then we adjusted the timeline to fit since we ended up having a special meeting, having it submitted by January 5th to start no later than January 26th and then finish by the end of June. So those are the updates, but happy to kind of go through each of the sections. I know we talked about wanting to make these more specific. So if anyone has specific activities or objectives that they wanted to add, happy to walk through those.
I think you added what Chelsea and myself were looking for, so I don't have anything else to add. I think we're good.
Okay, awesome.
Yeah, I'm fine with that, Michaela, as well.
Cool. And I haven't heard anything from Jen in terms of feedback either. She did, I mean, everybody got a copy of it, so haven't heard any other feedback from her.
I think it looks good. So I think next steps for us is to identify at least 3 vendors. And then I will work with our finance team to go through procurement, and hopefully we will have a strategic plan that we can start in the new year. So any ideas for vendors?
I can,
We've used MAPHN's using BME right now for their strategic plan.
All right, and I remember Jen at the last meeting said CMRPC.
Does JSI or HRIA do strategic planning?
I know HRA technically does. I don't necessarily know how many they
Have
do,
done.
but they do have a strategic
Okay.
plan.
We can definitely reach out to 4, so we could do BME, CMRPC, JSI, and HRIA. It's a lot of acronyms.
Yeah.
Any other ideas or suggestions?
Who did MHOA use? Did they just do one? Oh, they used BME. I'm just looking to see what other local public health places have used. Let's see, it looks like Lowell just did one. They did use BME as well. So
All right, so
Seems like quite a few have used BME.
yeah. For our strategic assessment of the Health and Human Services Department, we used CMRPC and had a great experience. So
Yeah.
I think reaching out to definitely BME, CMRPC, and then do we have a preference on the third, or would we, I think it's okay to submit to four and see what we get back.
Yeah, I mean, I can look real quick if you want to see if they do strategic planning,
Which one, JSI or?
either or. Um,
It does look like HRIA does it. I can share the webpage if people want to see it.
I think JSI does as well. I don't see it. If they do it, I think it's fine.
Okay. All right.
Do we need to make a motion?
Yeah, let's do that.
Do we need to include the spending amount, or did we already approve that?
I would include the spending amount. I'm not sure if we did
Okay, so I make a motion to approve going out to bid for a strategic plan for Greater Boroughs Partnership for Health to not exceed $30,000.
I second.
Do you want to include the vendors?
Sure. Um,
Sorry.
Considering BME strategies, JSI, HRIA, and what's the last one? CR.
CMRPC.
Yeah, thank you.
Anne-Marie,
I
do you want to
second.
second? Okay. All those in favor, Taylor?
Yes.
Anne-Marie?
Yes.
And Isabella, yes. Okay, perfect. So we will get working on that, Michaela.
Yay. That's it. Our our next meeting is January 8th. So we will see you all then. But that's all I have on the agenda unless there's any other questions or discussions before we.
Michaela, what time is the meeting on Thursday, the 8th?
10.
Yes, 10 a.m.
10 a.m. Okay. I have a virtual with PHEP, but I should be fine. It should be done by then.
Okay.
I make a motion to adjourn at 2:14 p.m.
Second. All those in favor, Taylor?
Yep.
Anne-Marie?
Aye.
And Isabella, aye. Perfect, short meeting. Have a lovely holiday. Take some time
too.
for yourselves, and we will see you in the new year.
Bye.
Good
Happy
to,
holidays,
good to
everybody.
meet everybody. Have a